Good morning, everyone. This is the second part of my lecture on atraumatic restorative treatment. Now, starting with the mixing. Now, the mixing of the GIC is very essential that it should closely follow the handling instruction of the manufacturer, particularly with respect to the powder and liquid ratios. A spoonful of powder on the glass slab or mixing bag should be placed, and the spatula is used to divide the powder into two equal portions and then dispense a proper liquid next to the powder. Uh, we should hold the liquid bottle horizontal for a moment to allow air to escape from the tip, move it to a vertical position and allow one drop of liquid to fall onto the slab. As you can see, the diagrammatic representation of horizontal placement of the bottle so that the air can escape. Firstly, the liquid should be spread over a surface of around 1.5 centimeters square. It is important to start mixing by adding one half of the powder into the liquid using the spatula. Roll the powder into the liquid gently, wetting the particles without spreading them around the slab. As soon as all powder particles are wetted, the second portion is folded into the mix. Now mix firmly while keeping the mass together. The mixing should be completed within 20 to 30 seconds depending on the brand of glass ionomers. The final mixture should look smooth like a chewing gum. The insertion of the mixture into the prepared cavity and over the remaining fissures must be done immediately. Use the applier cover to place small amounts of the mixture into the cavity. This technique will avoid air being trapped between the floor of the cavity and the glass ionomer. The entire application procedure must be completed within 30 to 40 seconds. Rub a small amount of petroleum jelly on the gloved index finger and press the soft restorative material firmly into the cavity and fissures, and then slide the finger smoothly across the occlusal surface of the tooth so that excess of GIC will get deposited in the remaining fissures. This is the press finger technique. The excess material is removed with a cover. Cover the ART restoration with a new layer of petroleum jelly. The patient is not allowed to eat anything for at least 1 hour. Dispense both powder and liquid onto the slab only when you have the cavity properly dried and protected from saliva. Replace the lid of powder and liquid carefully back into position immediately after use. This prevents uptake of the moisture from the air or evaporation of water component from the liquid. If more than 30 seconds are used for mixing and the mixture looks dry, do not use it because there will be poor adhesion to the tooth structure. Each type of glass ionomer may have its own specific needs, therefore, it is important to follow the instructions of the manufacturers carefully. It is important to work in a dry environment using cotton wool rolls. Replace these as required. Clean the cavity and ensure that the outline is smooth and free of caries. Place a plastic strip between the teeth and use this to make the correct tooth contour of the proximal surface. Insert a soft wood wedge between the teeth just at the gum margin to keep the plastic strip firmly in position. Condition the cavity as described to the one surface. Mix the glass ionomer as described before and insert it into the cavity until it is slightly overfilled. Hold the strip tightly with the index finger on the parallel side of the tooth. Wrap the strip firmly around to the buccal side to adapt the restorative material well into the cavity. Hold the strip with the thumb on the buccal side for 1 to 2 minutes until the material has set firmly. Remove the strip and wedge and cover the restoration with petroleum jelly. Remove any excessive material with the cover. Check the bite with articulation paper and apply another coat of petroleum jelly. Remove cotton wool rolls. Ask the patient not to eat for 1 hour. Now, selection of the teeth with carious cavity suitable for ART. A breakage in the tooth surface or a cavity in the tooth is recognized as decayed or carious tooth. With the probe, gently and carefully go into the cavity, which will feel softer and may even be quite mushy. The color will vary from pale yellow in a new cavity to dark brown if it has been there for a long time. Just a change of the tooth surface does not necessarily mean it is caries. Sometimes teeth can be discolored because of staining due to some foods. Carious cavities are usually classified by the number of surfaces affected. For example, one surface cavity, these occur in only one surface of the tooth, that is in pits and fissures on occlusal surfaces of premolars and molars, in pits on lingual surfaces of upper incisors, in buccal and lingual grooves of molars, in buccal and lingual surfaces just above the gingiva of all teeth, and in proximal surfaces. Pits and fissures on occlusal surfaces of premolars and molars, pits on the lingual surfaces of the upper incisors, buccal groove of the lower molars, buccal surfaces just above the gingiva, proximal surfaces of anterior teeth. Multiple surface cavities. These affect two or more surfaces of a tooth, that is, occlusal and proximal surfaces of premolars and molars, occlusal and buccals or lingual surfaces of premolars and molars, Proximal and buccal or lingual surfaces of anterior teeth. As you can see in the images, occlusal and proximal surfaces of a premolar and a molar, occlusal and lingual surfaces of a molar, proximal and buccal surfaces of an anterior tooth. Now it is very important to sharpen the dental instruments. Hand instruments that are used for cutting hard tooth tissues, the excavator, dental hatchet, and carver must be sharp to be effective. A blunt instrument is a definite hazard as it requires excessive force to cut enamel and dentine. The sharpness of the cutting edge can be tested effectively on the thumbnail. If the cutting edge digs in during an attempt to slide the instrument over the thumbnail, the instrument is sharp. If it slides, the instrument is blunt. Only light pressure is exerted in testing for sharpness. A special flat stone, for example, an Arkansas stone, is used for sharpening the hatchet, carver, and spoon excavator. The procedure is to follow as described step by step. Place the flat sharpening stone on a table, put a drop of oil on the stone, hold the stone firmly with one hand and rest the middle finger of the other hand on the stone as a guide. Position the cutting edge of the hatchet or the carver in the oil parallel to the surface of the stone. Slide the instrument back and forth over the stone several times for maximum sharpness. Take care that the surface to be sharpened stays parallel to the stone surface. This is the correct position as shown for sharpening of the instruments.